Never persist with overzealous or over-invasive treatment. This is another sort of sometimes an expression of our inadequacy because we don't know what to do. Trials are very good. We are happy when we get responses, but have we ever thought of the non-responders? They have only a few months to live, and we have ruined their quality of life. Not only that, we have taken away the most precious thing which they have, and that is their time, their limited time. Never palm her off to another department. This is another daily occurrence. There's nothing more I can do. Refer with compliment to the Department of Pain Relief. Obviously, we have to take the help of our pain relief departments, our palliative care, our physiotherapists, everybody. But make sure that we coordinate these efforts. Make sure that the patient knows that we are there. And make sure the patient knows that she has to come back to us to report what the relief of her symptoms is. Never underutilize pain relief drugs. This is a very common thing again. Why should we worry about addicting our terminally ill patients? Also, we don't understand the mechanisms of pain and the different combinations and drugs that we have. So we should never underutilize pain relief drugs. In this day and age, the patient should be reassured that she will be hopefully free of pain. And in this talk, I'm not going to speak about palliative care and physical care, but obviously it stands to reason the patient has to be kept physically comfortable if we are to keep her mentally and spiritually comfortable. So what should we do? Speak the same language. This patient is horrified. She's going to ask 5 doctors in the same department the same questions. And if she gets 5 different answers, she's going to land up in extreme confusion and unhappiness. Be objective, as I've said, and try and guard against depression and anxiety in ourselves. Make care available. This is also basic ethics. Care must be made available to the patient even when you can no longer do anything for her disease. Make appropriate clinical decisions and involve the patient or her family in these decisions. For example, a patient has an advanced cervical cancer and obstructive uropathy and she's going to uremic coma. Should we do a percutaneous nephrostomy, get her out of this coma, and let her die later with severe pain, or should we let her go gently in the uremic coma? These are decisions that we have to involve the patient or her relatives in. I'm not going to touch at all on euthanasia. That's another totally different topic. Assure the patient that we will improve the quality of life to the best of our ability and tell them we will stand by them. And most of all, we must appreciate and respect the courage and the dignity of the dying patient and her family. And it is amazing the courage that they exhibit. And it's not just the educated patients and the well-off patients, even the poorest patients coming from the village, totally illiterate. If we see them in their terminal stages, the courage and the dignity on their faces is amazing, and we never stop wondering at it. We have to give some glimpse of hope. It's not possible to give them a glimpse of hope about the treatment, but we can assist the patient to center hope on what is not going to fail. For example, our commitment to her, her self-worth, etc. We have to keep reassuring her that we are there. Till the end, we are there for you. This is what a physician said about his inadequacies. Slowly, I learned the importance of powerlessness. The dying know we are not God. All they ask is that we do not desert them. The patient has fears. We've discussed these fears. One of them is severe pain. We should be able to reassure her about that. Being dependent on others. Women are horrified of being dependent on others. People have always been dependent on them. Physical deformity, loss of function, concern for family, loss of control over things. They're suddenly on a roller coaster. They can't get off. They have no control left over their lives. And last but not least, loss of dignity. In a recent paper, a questionnaire was given to terminally ill patients, and believe it, loss of dignity, the fear of loss of dignity ranked even above the fear of severe pain. And we need to know this, and we need to make sure that the patient has her dignity till the end. She's going to ask at some point, directly or indirectly, can I be treated? And as I've said, we have to be frank, we have to be gentle. At this point, she may want to know about alternative therapies, and we can't turn up our nose at them. We need to know something basic about them so we can discuss with them. And if they're not going to harm her, we can probably encourage her to try them. It'll help her to focus hope. It might even improve the quality of her life. But assure her that she is not going to be alone, no matter what. How long do I have? As I've said, we can't give them a specific time limit. They should be encouraged to take and enjoy each day at a time. Add life to days and not days to life. My colleague was a resident in England, and this patient with recurrent ovarian cancer said, please tap my ascites. And she said, it's not that distended. Why do you want to tap it today? And she said, well, it's Christmas Eve. I want to look pretty. I want to put on a nice dress and go and dance with my husband. So this is adding life to days. And I'd just like to show you an example of adding life to days. I had a very, very dear friend who died of colon cancer about 7 years ago. And in the last stages of her disease, she painted this intricately beautiful painting. And they're all clovers. And she wrote this beautiful thing to her husband, and I took his permission and I've sort of scanned it. And time doesn't permit me to read the whole thing, but it starts off, why look for a 4-leaf clover? And by that she means a miracle or a cure. Why look for a 4-leaf clover when the day itself is so lovely? Why worry about cancer and death when the sun is out and we can hold hands and walk in our lovely garden? And the last line says, so why not just be good lovers for today and enjoy the fruits of the knowledge emanating out of this love and bask in the warmth of our family and this superbly wonderful day. And she died a few weeks after she painted this and she wrote this. And when she died, her husband and her daughter and her family, they were awfully upset, but they were all satisfied that they had spent quality time, and they were happy that they had discussed at the end with their wife and their mother, and they had been actually looked after by her in the last stages of her life. And this is what we have to learn from our patients. So before I end, I'd like to pay a tribute to our dying patients, to their grace, to their courage. I have a young colleague, a surgical oncologist. She's younger than me. She works much longer hours than me, morning to night in the operation theater. 5 years ago, she was diagnosed with ovarian cancer, stage 4. We operated on her. She took her chemotherapy, back at work, smiling, laughing, looking after other cancer patients. She took a long trek to Mansarovar, came back, showed us all the photographs. Abdominal recurrence 2 years ago, operation, chemotherapy, back to work immediately. 6 months ago, she got a brain metastasis and a bone metastasis. And she said, ma'am, I'm taking the radiotherapy during my lunch break because it makes me a bit sleepy. And today, even as I speak, it's a Sunday, but maybe yesterday, she was still in the operation theater, working long hours, or maybe she was sitting in the OPD, smiling and looking after other cancer patients. Can you believe this? So it is not just our responsibility, it is our privilege to help such patients cope with the stresses and to provide care, support, concern, no matter what. We are called upon not only to exercise leadership and be agents in the healing process, but to be unfailing advocates of the weak. It is as advocates of the weak that doctors may surely be most tested, with the dignity of the woman being the value most assiduously guarded. There may be no greater trust. Thank you very much.